Wong and Endologics for the opportunity to be here and share with you a little bit about some data about this leopard and anchor study. For the interest of time, in trying to cut down and make it as short as possible after you, we all see the nice clinical clinical presentation for both AFX and Ovation. I just want to share with you a little bit of the data that we have now for a little bit more cases and maybe some longer follow-up with Ovations that graph. I would like to share first about the AFX. This is the leopard trial, which is quite an interesting design study. This is a randomized control trial. Compare the anatomical fixation device, which is AFX, compared with the proximal fixation device, which is all the others that we are quite familiar with, like Zenith, Excluder, or the Endurance. And these are, they plan for over at least 400 patients in over up to 80 centers in the US, and would like to follow the patients up to 5 years to compare the results in which quite mid to long-term results. So far, the data that we have is up to like 455 in total patients have in the AFX anatomic fixation group and have in the proximal fixation group. And you can see that in the proximal fixation group, they use device Endurance, Excluder, Zenith, that compared to majority will be in the AFX 35. When you look at the demographics in two groups, they're all the same. Age, gender, race, ASA class, or history, comorbidities and things. And when we look at the anatomy, the variables, look at the diameter of the neck, aneurysm, the axis, pretty much the same between these two groups. And then the procedure time also pretty much the same, so I'm not going into much details. Interesting is this, the freedom from aneurysm-related complications. When we look at the anatomic fixation group, the AFX group is the dark blue on the screen, compared to the other three that we don't show you the name of the devices as here, but you can see that it's quite comparable with the other two. And then obviously one of the device has a little bit less satisfying result compared to the other three, but at least for the AFX compared to the device that we're quite familiar with, this device is the result is more comparable. Not to mention that the availability to treat more difficult anatomy. You just listened to Dr. Fujimura just present a little while ago. Again, the same is all-cause mortality, aneurysm-related mortality comparable. Look at the freedom from type 1A, type 1 endoleak, type 2 endoleak, or type 3 endoleak. I think it's also comparable, even though in type 2 seems to be a little bit less with the AFX. Freedom from conversion, freedom from rupture, comparable, and then freedom from limb occlusion, also comparable. Freedom from reinterventions, also comparable. So at least we have the data now add on to the benefit that we may get from the quite difficult anatomies that we can use the AFX at least up to 1 year now, compared to the proximal fixation device. These devices have very good results, and in some aspect maybe a little bit better than what we use. Let me so this is the summary that I would like to put in. AFX is comparable to proximal fixation device at least up to 1 year, and then it's good for anatomical fixation device, and then it's no need for contralateral fibrillation, not to mention to treat the small access and then actives that we just heard about. I'll chip a little bit to the encore, the Ovation. This is just to gather all of the experience that we have in the literature for 6 studies and over 1,200 cases, almost 1,300 cases for a variety of centers. And you can see that most of the cases have some challenging anatomy. Most of these will be the reverse curve, a conical shape that we talk about. But technical successful rate almost 100%. And then the total 30-day major adverse events also quite low. And then it's only over 1,000 cases and only 1 rupture, 1 conversion. So the short-term result is quite favorable for this device, the Ovation. When we look at the longer-term follow-up, now we have up to 5